Hello and welcome to the WIHS Journal, Public Affairs from 104.9 FM. I'm Paul Kretschmer, interviewing Dr. Dan O'Brien today and tomorrow about the coronavirus epidemic, especially the response by children. This is one of those subjects to begin my conversation with you, Dr. Dan O'Brien, that occasionally I get overrun by time. I record a conversation with a guest, and things change fairly quickly, and maybe I might have to scrap an interview because it's been overrun by time. But oddly enough, or maybe not so oddly, I suspect we'll still be talking about this for quite some time to come. So talking to you today is not something that's necessarily going to get run over by time anytime soon. I suppose that must be true, huh?
Right, correct. As you know, this coronavirus situation, it's very fluid. It seems like speed is everything, and it's rapidly changing by the day.
Now, one of the things I heard early on in the conversation among people, both at the lower level and at the governmental level and beyond, was the danger to older people. And that seems to be a factor quite often when it comes to illness, the susceptibility of older citizens to get something that either is harder on their older body system or is just one more load on the camel's back, so to speak, when they already have a pre-existing condition. But one of the things I also heard was that children were not necessarily getting coronavirus as readily as other people, or perhaps if they did come in contact with it, they would come back from it perhaps a little bit better than older people. How much of that is urban legend and how much of that's actually true?
Right, yeah, no, that's a great question. There's actually a lot of truth to that in regards to that the immune systems are so much different between children and adults. Children's actual immune systems are very immature, and they actually get about 8 colds a year, so their bodies are used to fighting off these infections. So they're actually mounting a different type of immune response, where as adults, as they get older, the immune system tends to wear off. So there's kind of a distinction between a child versus an adult immune system that's playing a crucial role in this, as well as inflammation. The inflammatory process is a lot different when looking at children compared to adults as well.
I think it's important at this point near the top of our conversation to explain to listeners what a coronavirus is, and as I understand it, there's more than one variation, and what it actually does to the human body that causes the reaction people have, which in turn could turn the direction into a dangerous situation for someone.
Right. So the coronavirus actually has been around since the 1960s, and it's actually a family of hundreds of diseases, and it's caused by the common cold as well as by pneumonia. But this COVID-19, it's actually a new disease. So there's actually a distinction that this has been around for a long time, but this COVID-19 is relatively new. So we just don't know enough as far as researchers and scientists on just the speed of how long this is going to progress for.
Is this something, because of the history, as you noted a moment ago, that might have been researched earlier if it had shown its ugly head earlier and caught the attention of medical researchers who in turn would have said, this is something we need to take a closer look at sooner than later? Or is it simply a matter of there's so much out there in the world that sometimes a specific illness gets targeted only when it rears its head and becomes a real problem, as COVID-19 is around the world right now?
Right. I think it's the former, right, of kind of the first thing you had mentioned, that, I don't think researchers and scientists really expected this to happen. I think there's been some speculation that people have thought, maybe years ago that this was going to eventually develop, but it's just so new with this COVID-19. Is what we know is just data that we have. We only have a couple months data with COVID-19, whereas, take other viruses or even the flu, we've got, 2,000 years of data. If you look at the flu, that's been around since the birth of modern medicine. So it's just how we look at the data, and as we're kind of learning more with the data, it's just going to be so crucial to getting answers to these questions.
There's been a lot of comparison between SARS and COVID-19 for one reason or another. Is there a valid reason to compare those two in terms of their specificity, or is it simply one happened a few years ago in the Far East and this one happened in the Far East, and so it's just kind of natural in the course of conversation to kind of throw them together in the same conversation?
Right. No, yeah, absolutely. That was back 2002, 2003, and I think we learned quite a bit from And the one thing that we learned is just how it affects children, and that SARS didn't really affect children that much. So just kind of like the coronavirus or with this COVID-19, we're seeing similar patterns of it not actually affecting children as much. So I think that we can learn a lot from SARS in that regard.
When it comes to nipping something in the bud, or at least trying to get an early jump in containment or treatment modalities and so on, does it make a significant difference between it happening in South America or in Europe or in North America first as opposed to the Far East?
Yeah, great question. I think to answer that question, it just really depends on what we have as far as the data. And I think we're just learning so much. And I think as these places where it's spreading to, we just keep learning more and more about the data and what we can extrapolate and kind of form and make more informed decisions based on that data. So where it spreads, it's really interesting when you look at, like you said, the Far East compared to other areas. It's so interesting. And as we learn more with the data, I think we'll have more answers.
The sense I've had in the last few days or week maybe has been that officials from many of the countries that are dealing with it right now have kind of shifted from containment to trying to test people and deal with their illness as it's happening, rather than being able to say we can put a wall up, or we can bring in the reinforcement troops from the rear lines up to the front and stop this thing before it goes any further. Is that the perception you've had too?
Yes, absolutely. And really, just to your point, just the more testing, we're going to keep identifying more cases through testing. We just have to make sure that the testing that we're doing, the test is actually a very accurate test. And I think that's going to be key as we learn more about, diagnostic testing in this regard.
When we come up with tests for something like this, do we deal with the creation of a test like that based upon the early symptoms and results, or do we play off some of the related circumstances of an illness to other illnesses and piggyback upon previous information to save time or otherwise?
Right. We would just go based off the new information. And really what the key is you want to find a diagnostic test that has a high NPV, right, which is a negative predictive value. So it's be able to rule out whether or not, the virus actually exists or not. So, it's going to keep these diagnostic companies definitely very busy. But just the more testing we do, that's how we're finding more people that have it.
I found it interesting, the reflection that the virus would be considered as something that broke out, so to speak, into the public attention in Asia, and then hear conversations in the last couple of days that a lot of the pharmaceuticals that are used here in the United States are also discovered but then manufactured, in fact, in Asia. Is that true also? Yes,
absolutely. I think that's going to be interesting as we move forward when we look at medication and where it's produced and how we can kind of overcome this.
Yeah. Do you feel that the United States has the capacity to recreate the kind of both lab and manufacturing facilities that the major pharmaceutical companies may have operated in the past, that they have outsourced to other areas of the world, including but not limited to China?
Yeah, if you look at the United States, we have some of the best health systems, some of the best medical schools, and some of the best companies that I think that really can help with this. If you look at the NIH, you look at Johns Hopkins, you look at some of these, very well-known institutions, particularly BEAST too, that you all have up there it's phenomenal. And I think that, the U.S. is going to come along very strong with this and be able to develop something to help the population.
I've noticed that Johns Hopkins' name has come up a lot in terms of identifying things that are going on and attempting to use by their previous statistical acquisition and analysis of where things may go or where they feel things may change or differ. That is something that does seem to be quite prominent in the news at the moment. Dr. Dan O'Brien, my guest today and tomorrow on the WIHS Journal. For further information, call us at 860-346-1049. That's 860-346-1049. The opinions expressed are those of the participants, not necessarily those of the staff or management of this station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from WIHS, Middletown.